circumcision? Why is that so effective? And thirdly, how have you gotten control of the virus?
What was the?
How have you gotten control over the virus?
Okay, I'm not sure what you mean by control, but I'll try to answer that.
You've obviously mitigated the effect.
Okay, all right. So let's start with the first one. Efficacy is under the best circumstances. You do a clinical trial. You have X number of people. You see them in clinic 5 times a month, once every 2 weeks. You have a special nurse practitioner who deals with them, counsels them, etc. It's the optimum condition. So when you give the drug, you do the circumcision, you do this, you know that under optimum situations, it works. It's an efficacious drug. Effective means, does it really have an impact when you're out there in the real world using it? And the best example of that is that if a person takes their pre-exposure prophylaxis every day, it's 95, I put 92, but it's up to 99% efficacious. If you go out into the community and you forget to take it, or you think, well, I'm not so sure this person is infected, or I'm a little bit drunk, or I'm a little bit this and that, and you don't take it, it's not an effective therapy. It's efficacious, but it's not effective. That's the first thing. The other thing, circumcision works is because in an uncircumcised anatomical situation, the foreskin that's over the glands of the penis has a degree of flora of bacteria that make the mucosa not infected necessarily, but more like a thin rectal or vaginal mucosa that's mucosa as opposed to keratinized skin. So keratinized skin, it's tough to get the virus through that. So you're dealing with the difference simply between a mucosal surface, which is thin, friable, and easily gets virus to go through it, and a skin, which is very difficult to do. So after a period of time following circumcision, part that looked like mucosa actually becomes almost like skin. And that's a protective mechanism. So that's how that works. And with regard to, the virus is highly sensitive to an antiretroviral drug. So if the virus comes in and starts replicating and destroying your body's immune system, when you stop the replication of the virus, that's it. It doesn't destroy anything anymore.
Why hasn't it worked?
Why hasn't it worked?
No, why hasn't it responded to your treatments?
Why hasn't it more?
Viruses respond.
Well, HIV happens to be a very responsive virus to a combination of drugs. We don't have a drug for every virus. We don't have a drug for rabies. We don't have a drug for some of the others. We have a drug for HIV. The difficulty is you have to take it every day. It doesn't go away after a week. Yeah.
Hi, Dr. Fauci. Thank you so much for your talk today. I guess the cornerstone of prevention, at least, is safe sex in regards to HIV transmission. I work at a HIV center in Philadelphia, and a lot of serodiscordant couples there, specifically male positive, female negative, have expressed the wish to have children, to conceive. Do you think that with kind of the data surrounding PrEP and, I guess, maternal HIV transmission potentially being stopped, is there a case to be made for natural conception?
The success in people who are discordant has been spectacular. There's so many different ways to do that. You can, first of all, when you put the person on therapy, you get their viral load down to below, most of the time, you can get them down to below detectable level. That still doesn't mean that there is not some infected cells in the sperm and the other cells that go along with the sperm. You can wash the sperm down and just do pure sperm. Sperm does not get infected. The lymphocytes and monocytes in the ejaculate can have that. So you could actually spin the sperm down, artificially inseminate, or even do an in vitro to make sure you examine each and every one. So it can be done.
But I mean, I think so this clinic in particular serves low-income individuals. And I guess sperm washing and IVF and similar techniques aren't really that accessible to a large chunk of people. And especially, I guess, this can be extrapolated